Yeah.
So I was looking at the stack of research for today, and I just had this moment where I realized how strange our cultural programming is.
Mm.
We can talk about, gut microbiomes or brain chemistry at a dinner party, and everyone's fascinated.
Right. You sound smart.
Exactly.
Yeah.
But the second we pivot to vaginal health, it's like the volume in the room just drops. It's treated like this shadowy, taboo subject.
It's the paradox of women's health, isn't it? I mean, we're talking about a biological system that half the population deals with, every single day.
Every day.
Yet we treat it like it's classified information. And that silence, it really has consequences.
That is exactly what I want to get into today. Because reading through this deep dive from Era Organics, it struck me that by treating this stuff as TMI, we're basically driving a car without ever looking at the dashboard.
That is a perfect analogy.
We're just ignoring all the signals until, smoke starts pouring out from under the hood.
It is a perfect analogy because the female body, specifically the vaginal ecosystem, it has an incredibly sophisticated dashboard. It's got these check engine lights that come on long before a catastrophic failure.
Right.
The problem is most of us just haven't been taught how to read the gauges. We just assume any blinking light means infection, buy an over-the-counter cream, and sort of hope for the best.
And a lot of the time, that's the absolute wrong move.
It can be.
So our mission today is to essentially open the manual.
Mm-hmm.
We're going to decode the 10 most common issues, the warning lights,
Mm-hmm.
and figure out what's actually happening biologically. And I want to start with the environment itself.
Okay.
I was surprised to see how much the research focused on acidity. I usually associate acid with something, harsh or bad for the skin, but here it says it's non-negotiable.
It's the absolute first line of defense. A healthy vaginal environment has to be acidic. We're talking specifically between a 3.8 and a 4.5 on the pH scale.
Wow.
So to put that in perspective, that's similar to the acidity of, say, a tomato or maybe a glass of wine.
So why? Why does it need to be that aggressive?
Well, because it acts as a kind of chemical gatekeeper. We call it the acid mantle. Most of the harmful bacteria and pathogens that might want to set up shop down there, they just can't survive in that low pH.
They can't handle it.
They need a neutral environment to thrive. So the good bacteria, specifically a type called lactobacilli, they churn out lactic acid to keep that pH low. It's a self-sustaining security system.
So the good guys are kind of terraforming their own planet to keep the invaders out.
Exactly. But here's the catch. That environment is fragile. The data suggests that up to 30% of women are walking around with a pH imbalance at any given time.
30%.
And when that pH creeps up towards neutral, so anything above 4.5, the security system is down, the door is unlocked.
And that leads us straight to the big two. The research really highlights that when that door is unlocked, two specific conditions tend to just rush right in.
Mm-hmm.
Yeast infections and bacterial vaginosis, or BV.
Mm-hmm.
And I feel like these get used interchangeably in conversation, but they are. They're fundamentally different beasts.
Oh, they're completely different biological events. And confusing them is actually dangerous because the treatment for one can actually make the other one worse.
Okay, let's start with yeast. The stats here are just staggering. 75% of women will experience this. It's almost universal.
It is. And the important thing to understand about a yeast infection is that it isn't an invasion from the outside. Candida, which is the fungus that causes it, is almost always present in the body in small amounts. It lives on our skin, in our gut, in the vagina.
So we're already carrying it.
Yes. But usually that acidic environment and our immune system keep the population really low. It's kind of dormant.
Okay.
But if the conditions change, let's say a spike in your sugar intake, maybe a round of antibiotics that kills off the competition, or a hormonal shift, the candida sees an opening and just explodes in population.
So it's an uprising, not an invasion.
Precisely. That's a great way to put it. And the symptoms are very specific. You get that intense, maddening itching and burning, and the discharge is the key visual indicator. It's thick, it's white, it's clumpy. The classic description is cottage cheese, which is unappealing but very accurate.
Okay, so that's yeast, an internal fungal overgrowth.
Yeah.
Now, how does bacterial vaginosis differ? Because looking at the notes, BV seems, a lot more complex.
Okay, so think of your vaginal microbiome like a carefully tended garden. In a healthy state, you have this lush green grass that's the lactobacilli covering everything, preventing weeds from growing.
Right.
A yeast infection is like a sudden rainstorm that causes a specific type of fungus to bloom in one corner. But BV is different. BV is like the chemistry of the soil changing entirely. The grass dies off, and suddenly a dozen different types of weeds, these harmful anaerobic bacteria, they just take over the entire lawn.
So it's a total ecosystem collapse.
Yes. It's a shift in the dominant species. Instead of the good bacteria, you get an overgrowth of bacteria like Gardnerella. And because these bacteria function differently, they produce different byproducts. And that's where the symptoms come from.
Okay.
The tell for BV is a thin grayish or yellow discharge and a very distinctive fishy odor.
And we really need to talk about that odor because I think there's so much shame attached to it. But biologically, what is creating that smell?
It's actually simple chemistry. When these anaerobic bacteria break down proteins, they release something called amines, specifically compounds called putrescine and cadaverine.
Wow.
That's what creates the strong scent. It's not about being dirty. It's a metabolic byproduct of a bacterial imbalance.
That distinction is huge. It's not a hygiene failure. It's a bacterial byproduct. Now, the research made a point that BV is often seen in sexually active women, but it's technically not an STI. That feels like a fine line to walk.
It's a nuanced distinction for sure. You don't catch BV from a partner in the way you'd catch, say, chlamydia. However, sexual activity, specifically the introduction of semen, which is alkaline, can temporarily disrupt that pH. It can kill off the good grass and allow the weeds to take over. So sex can be the trigger for the imbalance, even if it's not the source of the infection.
But just because it's not an STI doesn't mean it's harmless. I mean, the deep dive mentioned some pretty serious downstream effects if you ignore it.
This is why we can't ignore the dashboard. Untreated BV keeps inflammation levels high. It can lead to pelvic inflammatory disease or PID, and this is crucial because that protective acid mantle is gone. It makes you significantly more susceptible to contracting actual STIs like HIV, gonorrhea, or chlamydia.
So if the bouncer isn't at the door?
Anyone can get in.
Okay, so those are the infections. To check engine light is flashing because something is growing that shouldn't be. But what happens when the light is flashing? There's pain, there's discomfort, but there is no infection.
This section on pain really stood out to me because it feels like a medical blind spot. It is the most frustrating category for patients. You have pain, you go to the doctor, they run a swab, it comes back negative, and you're sent home. But the pain is real.
Let's talk about vulvodynia. Before this research, I had no idea how common it was. 16% of women. That is millions of people.
Millions. And vulvodynia is essentially a chronic pain condition of the vulva without an observable cause. We're talking about burning, stinging, rawness, or stabbing pain that can last for months, even years.
And because it's not an infection, antibiotics do nothing.
Exactly. Current research suggests this is often a neuropathic issue. So it's not that the tissue is damaged, it's that the nerves supplying the tissue are hypersensitive. They're firing pain signals even when there's no actual threat. It's like a car alarm that goes off when a leaf falls on the hood.
That sounds incredibly isolating.
Right.
I mean, the psychological toll of being told everything looks normal while you're in constant pain must just be devastating.
It is. The average time to diagnosis for vulvodynia is often measured in years. Women see multiple specialists. And the treatment isn't a simple pill. It often involves pelvic floor physical therapy to desensitize the nerves, biofeedback, sometimes tricyclic antidepressants to calm the nerve endings, or topical anesthetics. It really requires a whole-body approach.
And sometimes the pain isn't nerves, it's more mechanical, a vaginal dryness. I think the cultural stereotype is that this is exclusively a menopause issue. But the data says 17 to 45% of women over 40 deal with it. And it can happen much younger, too.
Oh, it is definitely not just a menopause issue. While the drop in estrogen during menopause is the biggest driver, estrogen is what keeps the vaginal walls thick and elastic. Things like stress, dehydration, and certain medications like antihistamines or antidepressants can dry out mucous membranes everywhere in the body. That includes the vagina.
Wait, antihistamines?
Oh.
Like allergy meds?
Yes. Think about what they do. They dry up your runny nose. They dry up all secretions. They don't discriminate. So if you're on heavy allergy meds, you might notice dryness elsewhere. It's a systemic effect.
That blows my mind. We treat these systems as totally separate silos. And speaking of silos, let's talk about the skin itself. Vulvar dermatitis. This is essentially a skin reaction, right?
Yeah.
An external thing.
Yes, this is the external factor. If you have itching and redness on the outside, but your internal pH and discharge are fine, you're probably dealing with contact dermatitis. And the culprit is usually in your laundry room.
We love our scented detergents. Tropical Breeze, Mountain Spring.
And those scents are chemical irritants. But it's not just the scent, it's the enzymes. Modern detergents are packed with enzymes designed to break down biological stains all day. proteins and fats. Well, your skin is also made of proteins and fats, so if that residue stays on your underwear, it is slowly breaking down your skin barrier all day long.
So you're literally wearing a chemical attack.
Essentially, yes. Just switching to a free and clear detergent and double rinsing your underwear can sometimes solve a chronic infection that was never an infection to begin with.
Let's zoom out a bit.
Right.
We've looked at the local issues, but I want to connect this to the rest of the body. You mentioned antihistamines, but the research brought up a connection to diabetes that I found really compelling.
This is a classic example of systemic health showing up locally. We know that yeast feeds on sugar.
Right.
In a diabetic patient, or even someone with prediabetes, blood glucose levels are elevated. That excess glucose doesn't just stay in the blood, it permeates into mucus secretions, including vaginal secretions.
So you are essentially baiting the yeast.
You're providing an all-you-can-eat buffet. The yeast that is normally dormant suddenly has unlimited fuel. So if a woman is coming in with recurrent, stubborn yeast infections that just won't go away, a smart clinician will check her A1C levels. The vaginal infection is the red flag for the bigger metabolic issue.
That is the check engine light in action. The other big lifestyle factor mentioned was clothing. We live in the era of athleisure. Everyone is in tight leggings all day, every day. Are we doing this to ourselves?
To an extent, yes. The bacteria and yeast we are trying to avoid, they thrive in environments that are dark, warm, and moist. Synthetic fabrics like spandex or polyester, they trap heat and moisture against the skin. They don't breathe. If you wear those for 12 hours straight, you are creating a perfect greenhouse for bacterial overgrowth.
So the cotton underwear advice isn't just something grandmas say.
It's physics. Cotton wicks moisture away, and it allows for airflow. It breaks that warm and moist cycle. And another tip, sleep without underwear. Let the area breathe for those 8 hours. It significantly lowers the risk of imbalances.
Okay, we have to address the biggest do not in the guide. Douching. The source material was incredibly firm on this, but I feel like there are still products on shelves telling women they need to smell like a chaotic floral arrangement.
It's marketing preying on insecurity, and it is physiologically damaging.
What is actually happening when you douche?
Okay, imagine you have that carefully tended garden we talked about. Douching is like taking a fire hose and just blasting away the topsoil. You aren't just washing away a bad smell. You are stripping away the protective mucus and physically flushing out the lactobacilli, the good bacteria.
So you're removing the security guards.
You are evicting them. And once they're gone, the pH rises and the pathogens, which are often more resilient, they rush back in first. Women who douche are statistically much more likely to develop BV and pelvic inflammatory disease.
Wow.
The vagina is a self-cleaning oven. It relies on discharge to flush out old cells. It does not need a power wash.
Loud and clear. Put the hose down. Now let's pivot to what we should do. We've covered the standard antibiotics and antifungals, but the deep dive from Air Organics highlighted some specific ingredients that sort of bridge the gap between medicine and nature. I want to ask about boric acid.
Sure.
To me, boric acid sounds like something I'd use to kill ants in my kitchen. Putting that internally. That sounds terrifying. Can we demystify that?
It does sound harsh, I get it. But in the correct medical dosage, it's an incredibly powerful tool. Boric acid is an antiseptic, but its superpower is that it can break down something called biofilms.
Biofilms. What are those?
So remember how we said BV can be really stubborn? Often the bacteria will build this sticky protective shield around themselves. That's a biofilm. Antibiotics sometimes just bounce right off the shield.
Okay.
Boric acid is chemically acidic enough to dissolve that shield and reset the pH environment, making it hostile for the bad bacteria, but without causing the systemic resistance issues you sometimes get with antibiotics.
So it's like a bunker buster for the bacteria.
Exactly. It's often used for women who have recurrent BV that keeps coming back after antibiotics. It just hits the reset button on the whole chemical environment.
Okay, that makes sense. The other ingredient mentioned was in the context of dryness hyaluronic acid. I know this from face serums. It's the plumping stuff, right?
It is. Hyaluronic acid is a molecule that naturally occurs in our skin and our connective tissue. Its unique property is that it can hold up to 1,000 times its weight in water.
1,000 times, wow.
So when it's applied to the vaginal tissue, like in the moisturizers mentioned in the text, it's not just sitting on top like a lubricant. It is actually drawing moisture into the cells and holding it there, helping to reelasticize the tissue. For women who can't use hormonal estrogen creams, maybe breast cancer survivors, this is a vital non-hormonal option to stop the tissues from sinning and tearing.
It's fascinating to see skin science applied where it's, maybe needed most. It moves the conversation from just deal with the pain to here is an actual molecular solution.
And that's the goal.
Yeah.
Whether it's understanding that a fishy odor is just a chemical amine, or that vulvar pain is a misfiring nerve, or that dryness is a lack of moisture retention, once you understand the mechanism, you stop blaming yourself.
That really seems to be the theme here. These symptoms, the discharge, the smell, the itch, they aren't character flaws. They're data points.
They are simply your body trying to communicate. If your check engine light came on, you wouldn't feel ashamed of your car. You'd check the oil.
So for the listener who has been dealing with something weird for months or years, maybe buying over-the-counter creams that just don't work, what's the move?
The move is to take that data to a professional, but go in armed with this knowledge. If you know the difference between yeast symptoms and BV symptoms, you can advocate for the right test. If you know vulvodynia exists, you can ask about it if your tests come back negative. You have to be the manager of your own dashboard.
And stop wearing tight leggings to sleep.
Please. Cotton pajamas or nothing at all.
I love it. This has been such an eye-opener. It really turns a taboo into a textbook, and I think that's exactly what we needed.
Knowledge is the best medicine.
Thanks for breaking it all down for us. And to everyone listening, pay attention to the signals, treat your body with a little grace, and we'll catch you on the next deep dive.